Hello everyone, today I'm going to show you how to do first aid on the most common joint injuries. So first off, we have the wrist sprain. If you see any signs of fracture, make sure to get help immediately. For the meantime, immobilize the wrist to prevent further damage. Find something rigid to use as supports to make the splint, such as sticks, boards, or even rolled up newspapers. You can then bandage the wrist with a splint. Apply a cold compress if there is swelling and pain. You can make a cold compress using ice or bagged frozen vegetables. Wrap those in a towel or you can put them in a pouch. This is to prevent swelling and to eliminate the pain. You should do a cold compress for 20 minutes 4 to 8 times a day until the pain or swelling is gone. It'll also help if the patient takes an anti-inflammatory drug if it is safe to do so and they aren't allergic to it. Make sure that the wrist is in an elevated position, especially when resting. This is done to prevent swelling. It is very important that your wrist is immobilized. This means that you shouldn't move it or exert force until it is fully healed. Up next is knee injury. It is very important that the first aid is applied for the first 48 to 72 hours. When you get a knee injury, stop activity immediately. Rest the joint. You can reduce pain, swelling, and possible internal bleeding if you apply a cold compress. It must be applied for 20 minutes every couple of hours. You can make a cold compress using the tips mentioned earlier. After the cold compress, we can then bandage the area. Here is how to properly bandage a knee. Always start in the middle. Wrap it at least twice around the knee. Make sure that the bandage goes until the lower part of the leg. If your bandage is too short, you can just get another one and then wrap it around just as shown in the video. Again, this is done to prevent the swelling and prevent blood from accumulating in the lower part of the leg. In bandaging, it is important that the tightness is constant or unchanged. And then go ahead and secure it with the bandage clips. Elevate the leg at all possible times. And let's move on to the last one, ankle sprain. Remember that in first aid we have something called RICE, R-I-C-E, and it stands for rest, ice, compression, and elevation. Always apply them when providing for first aid. Let's try out the RICE method on this ankle sprain. First, rest it. And in order to do that, stop activity or stop moving your ankle. After resting, we've got I, which stands for ice. You can do this either by applying an ice pack or if it is available, you can soak your ankle in ice cold water. Do this for 15 to 20 minutes every 3 hours while you are awake. The next step is C, compression. We can do so by applying a bandage. Watch the demonstration carefully to see how to properly bandage your ankle. Avoid creases as much as possible. This is so it'll be more comfortable. And then secure it with the bandage clips. After compression, the last one is E, which is elevation. Elevate your ankle at all possible times. Do remember that these are all just first aids, and you still need to visit your doctor to make sure that your bone structure isn't damaged. And that's it, we're done. These are the first aids that you need to perform when it is needed. Again, remember that first aid is just temporary and professional medical help is still needed.